Hey everybody, doing my paper on mental health disorders and periodontal disease. And I picked the two most common disorders that we're probably most likely to see in our chair, which is going to be depression and bipolar disorders. So, periodontitis is a common microbial-induced and multifactorial disease that affects the surrounding periodontium of the teeth from causative microorganisms. Periodontitis can present itself in chronic and acute forms, and the majority of mental health disorders affected by diseases have an affair with the chronic state. As the strains of an individual's life develop, psychosocial factors become out of hand, which include overbearing amounts of stress, depression, loneliness, and increased anxiety. With this in mind, researchers have identified a strong indication between oral health and mental health. Etiological biofilm factors aren't the only influencing factors. Host factors of mental health are becoming predominant role players. Periodontal disease has commonly been associated with chronic mental illnesses such as depression and bipolar disorders. So the first one is depression. Connecting oral health with mental health has become a more prevalent topic in recent years, as well as a topic hard to ignore. According to the World Health Organization, depression can be presented as a loss of interest, of pleasure, a depressed mood, a disturbed appetite, disturbed sleep, poor concentration, and low energy levels. A majority of individuals presenting with depression and periodontal disease have severe determinants including low education levels, low socioeconomic levels, old age, and ethnicity. A high correlation has been seen between negligence of an individual's oral health and neglect of professional oral health care who's experiencing depression, as well as showing a correlation in affecting the hypothalamic, pituitary, thyroid, and axis systems. When these areas of the brain become affected by a depressive state, the immune system is compromised, therefore allowing a periodontal disease to take a predominant form. The disease is a bacteria-mediated inflammatory form, meaning that when the immune system is compromised from a mental disorder, the body is unable to fight and resist destruction in the oral cavity. A neuroendocrinal study on the correlation between depression and its effects on the brain associated with chronic periodontal disease found that depression creates a disturbance within the hypothalamic, pituitary, and axis systems, where an increase of corticotropin was released, causing a negative alteration on the limbic systems. Cortisol's depressive effects on the limbic system and immune defense showed an increase in initiating periodontal disease and allowing red complex bacteria to thrive in an immunocompromised environment. Historically, a more rigorous form of periodontitis can be seen in depressed patients. A study from 1961 determined psychiatric patients had deteriorated periodontiums when experiencing severe stress. The study determined that increasing cortisol levels along with adrenocorticotropic hormones caused a negative effect on the periodontium. Aside from a hormonal change causing periodontal changes, depression can have medicinal and mechanical effects contributing to the induction of periodontitis. A more obvious connection for patients to understand when it comes to mental health and periodontitis is the lack of motivation caused by the depression of the limbic system. Motivation and a sense of well-being becomes diminished in a patient with depression, and results have proven a lack of self-care and an alteration in health-related behaviors intertwined with progressing disease. Increasing uses of tobacco products, poor attention to diet, and lack of exercise and social interaction shows to be associated with higher prevalences of periodontal disease. Patients diagnosed with depression also experience medicinal side effects from antidepressant medication, which leads to xerostomia. Medications can cause changes in the gingival crevicular fluid, as well as the composition of the saliva, which can be exacerbated in the progression of disease. In early stages of diagnosis and depression, gingivitis and xerostomia become more prevalent, which will eventually lead to periodontitis if combined with mechanical and hormonal changes untreated. The presence of periodontal disease in chronically depressed patients continues to grow, and without the aid of a dental hygienist giving a better understanding of the correlations between the disease and periodontitis, depression, and the disease will continue to evolve together. Bipolar disorder. A wide array of publications have been made on identifying the stemming effects of bipolar disorder, or BPAD, on the periodontium. A strong mechanism that influences periodontal disease and BPAD is induced stress from a constant change in an individual's behavior. It is commonly seen in patients with intensified negligence of their oral health and that they no longer keep track of when they perform a regular home care regimen. An increase in deleterious changes in the immune system occurs as well. A study done in 2020 determined that there is a strong association between BPAD and periodontitis, presenting interactions of chronic inflammation in the hypothalamic, pituitary, and renal axis. The immune reactions produced from periodontal disease increase cytokines and neuroinflammation. Cytokines readily reduce synthesized tryptophan and serotonin, including oxidative stress in the body and increasing mood swings in the patient. Patients experiencing bipolar disorder will also have increasing episodes of mood swings that will induce more violent forms of brushing, which places strain and damage to the gingiva and tooth structures. Clinicians who see patients experiencing symptoms of bipolar disorder should discuss with them long-term and short-term goals in order to bring their disease under control to prevent further damage. Understanding the immune correlations between the two diseases is important in treating a patient and giving adequate home care instruction. Strong interactions between oral health and periodontal disease can be seen clearly in patients who are demonstrating a specific mental health diagnosis. Any type of psychiatric disorder will have an increase in microbial counts and large effects on the immune system through alteration of cells and hormones, as well as the mechanical actions on the body. Depression is a more common mental illness seen today and is therefore more likely to be seen in a patient during an appointment. Clinical signs such as stress, low energy levels, and loss of appetite should be recognized, and treatment should focus on teaching the patient about the relationship to their periodontal status and how to manage their depression without worsening the progression of disease. The patient diagnosed with bipolar disorder should come in routinely, and thorough documentation of any extreme changes due to mechanical or hormonal means should be noted in the chart. The dental hygienist needs to help the patient understand the importance of paying attention to home care and give instructions on how to conscientiously brush without causing further damage. While there are many other mental disorders, among these two, the dental hygienist should be knowledgeable on how periodontitis can present itself in a patient experiencing mental health disorders and be able to intervene with a detailed treatment plan to control the progression. That is my paper. Thanks. Sorry, I'm so awkward.